Let's talk about the often overlooked connection between neurodivergence and eating disorders. For autistic and ADHD folks, eating struggles aren't just about control. It's often also about safety, sensory needs, and shame. We know that autistic and ADHD people are at significantly higher risk for eating disorders and eating distress, but this often goes unrecognized. ARFID, avoidant restrictive food intake disorder, is seen very commonly in autistic individuals. For ADHD folks, we quite often see binge-restrict patterns. These patterns often don't fit the typical eating disorder stereotypes, meaning they get misdiagnosed or unrecognized entirely. Sensory issues can also make certain foods intolerable. Think smell, texture, temperature, and even sound. For many, food routines aren't about control. It's also about safety and stability. Executive function challenges can often make meal prep or planning overwhelming, which can result in skipped meals or an over-reliance on quick fixes. Black and white thinking can also lead to strict rules around food and moral labels such as good food and bad food. We know that ADHD in particular is linked to lower levels of dopamine, which affects reward and impulse control. And sometimes this leads to people binging or grazing for stimulation and comfort. Eating junk foods, particularly those high in things like fat, sugar, and salt, gives the brain that quick dopamine fix, which can increase feelings of connection, comfort, and calm. Trauma can worsen food habits. For some, it's the only sense of control they feel they have. Others may dissociate from hunger and fullness cues. Similarly, struggles around interoception can also complicate matters. It can make it difficult to not only identify when we're hungry, but also when we're full. And many neurodivergent people mask their eating distress and feel deeply rooted shame for not being able to eat normally. They're often told that they're too picky, too disorganized, too impulsive, and end up blaming themselves for needs that are both biologically and psychologically valid. So, what needs to change? We need to endeavor to move beyond support that is weight-focused and appearance-focused. We need eating disorder care that is both neurodivergent-affirming, trauma-informed, and deeply validating. This means understanding food differences as valid adaptations, not pathology. And it means listening, not correcting. If you're neurodivergent and struggle with food, know this. You are not broken. Your brain, body, and experiences all shape the way that you eat. It's a biological difference, not a personal failure. You deserve support that understands your brain, your body, and your need exactly as they are.